Hi everyone, this is Shalu Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. Welcome back to my YouTube video again. So if you like my videos, please press the like button now and subscribe to my channel. So today's video, we're going to talk about another station for you for your NMC, adult NMC OSCE exam. Okay, so today we will be talking about another scenario, which we will be talking about fall and fracture scenario this time in your NMC OSCE exam. So I will be telling you what is this scenario about, how to do assessment station for a scenario if you get a patient scenario where the patient has had a fall and a fracture. Okay, what things to keep in mind, what paperwork you will get, what nursing needs you can discuss in holistic assessment and how you can address them. So we're going to look step by step into that. Okay, so we will go through it and I will tell you what things to be careful about, because lots of nurses actually fail this scenario. So we need to be careful, but that we maintain patient safety. It will make more sense when you watch the video. So I will tell you why people are failing, why nurses are failing this station. So we will have a look in that in a minute. So let's get started. So let's bring our first slide up, which is that you know that assessment station is 20-minute station, including the reading time, and you will be given a patient history form to read, as you can see on your screen. Now this doesn't belong to a specific patient, it's just for teaching purpose, just to give you some idea what does it look like. And you can see there is I've highlighted some stuff on it, which means, you know, what can you expect in the scenario that your patient had a fall and they are in hospital now, so they are bed bound, and the diagnosis is that it looks like they have a fractured neck of the femur, so and hip, obviously they got hip fracture, so that's what it is, so they are bed bound and they are on the ward now with this fracture. So that's kind of tell you, and of course the patient is in pain. So that's what kind of patient history looks like, just an example. Okay, so then what do you need to do in 20 minutes on the next slide? So you do need to take the vitals. So it's assessment station, so you always take vitals. You still need to complete the news chart correctly. You still need to verbalize your monitoring frequency and escalation correctly according to the news 2 policy. You also need to conduct a full A2E assessment as per the marking criteria. Okay, so make sure you know what's in the marking criteria for A2E assessment. So you need to do as per marking criteria set by NMC. And then you carry out the holistic assessment of your patient physical, psychosocial, spiritual and sexual needs. So that's what you need to do in 20 minutes. Okay, next screen, what document you be completing, what actual document your examiner mark, it would be the news chart. Okay, so patient history form is for you to read and make any notes on, but it's the news chart which your examiner marks. Okay, news 2 chart. So make sure you correct it accurately and very, very clearly. Okay, because without completing it correctly and clearly, you cannot pass this station because it's your document. So you definitely need to do it with care. So let's look at the scenario itself and now what kind of nursing needs you can discuss. So what makes this scenario different to other scenarios? Okay, because rest of the things are very common you do for every scenario. So let's see what kind of things we can look into patient holistic assessment in this one. So the physical needs part. So what are the specific things you can come across in this scenario? The first one is pain. Of course, it's a fracture. It's very painful. Having fracture is very painful. So you do need to assess your pain regularly on your patient. So that's what you will be mentioning to the patient, that you understand they are in pain. You're going to assess their pain regularly using universal pain tool 0 to 10, where 0 is no pain, 10 is the worst pain, and then they can tell you what is their pain score, and then of course then you will verbalize that you will give medication according to the patient pain score. So that's the medication bit. So you'll be verbalizing, I'll be checking your pain regularly using pain tool 0 to 10. I will be giving you regular pain medication. You can ask your patient to do some deep breathing exercises, some distraction technique, so to distract their mind of the pain, because pain is going to be there with the fracture. So those are the things. And if their pain is not controlled by the pain relief which is written on their drug chart, then you will say that you will escalate this to the medical team so they can review the pain medication. Okay, so reassure your patient that you're going to manage their pain really well and keep them as comfortable as possible. Okay, so that's the first thing to discuss about. Now, mobility is the another issue. As to your patient is bed bound, okay, so you cannot obviously do any mobilization out of bed because they have a fracture of the hip, so you cannot stand the patient outside. And that's where I was saying the safety here. So don't compromise patient safety by saying, oh, I can give you a bedside commode or something like that. No, you cannot take a patient who's got hip fracture onto a commode, okay, or you can't stand them up. They cannot weight bear. So it's really important, and that is the thing nurses are failing on. Okay, so you really do not want to compromise patient safety. That patient cannot get out of the bed. Any care given will be of course in the bed. Okay, so you could change their position, could keep them comfortable, relieve the pressure areas, but you cannot take them out of the bed in that sense because they got fracture, unless it's when it gets fixed. Okay, after that you can think about those things. So next thing is the risk of pressure ulcer. So that's really important because your patient is bed bound. There is no obviously no mobility in that sense, so they are at high risk of developing pressure ulcer. So you will verbalize that you will regularly check the pressure areas. You can use pressure relief mattresses, and also if there is moisture is problem with the patient, then you need to see if they have any history of incontinence or anything like that, because moisture is an additional risk for developing pressure area ulcers, because we know that. So we do need to be looking into that they are kept dry and comfortable, and any other risk factor for pressure ulcer that we should be preventing on a patient, because a bed-bound patient is very high risk of developing pressure ulcers. So do advise them to have good, well-balanced diet to prevent the pressure ulcer as well, and also say to them that you're gonna keep checking on their pressure areas. You will use the pressure relieving aids like mattresses, and also, you know, if you will make sure they are kept dry and comfortable if they do have any history of incontinence. Okay, next one, of course, this is just kind of physical problems you're talking about, and these are the possibilities which can come in your scenario: pain, mobility, risk of pressure ulcers, or anything like if the patient has history of incontinence and stuff, then I already mentioned that to you, so you can talk about that. Now, again, you don't forget, it's a holistic assessment, so still need to look into patient psychosocial status, how they are emotionally, are they anxious, is there anything you can do about that, give them reassurance. Any spiritual needs, are they religious, do they have any spiritual need, and of course maintaining their privacy and dignity is very important in their sexual needs, so that you will mention always. Okay, so so that's kind of things you can come across in this scenario, and how you can then keep within the safe practice, but make sure you are not verbalizing that you'll be taking that patient out of the bed. Okay, so it's important that you don't do anything like that which is going to compromise patient safety, and that's the point I wanted to make it come across today. Okay, because lots of nurses do fail on this point. Okay, so make sure you don't do those mistakes. So hopefully this video is going to help you to understand this scenario a little bit better, and show safe, competent practice to your examiner while you're doing this station for assessment for this fall and fracture scenario. So I hope you like the video, and if you do like the video, please press the like button now and subscribe to my channel, and keep those good comments coming in. Okay, they do really help me to keep me motivated to make these videos, because they can be quite hard work to prepare and make them, but I do them to help you with your revision. So please like and subscribe, and if you want to visit us, you can visit us on oskinurstraining.com or email us on oskinurstraining@outlook.com. I will soon be back with another video for you. So bye for now.